Welcome, everyone. Today, we're diving into one of the most important foundations of dental billing, anatomical terminology. Understanding these terms will help you read documentation accurately, code correctly, and prevent claim errors. Let's begin. In today's quick lesson, you'll learn three important things. First, why accurate, standardized documentation is essential in healthcare. Second, key human body directions and anatomical orientations. Third, and how this knowledge helps you bill correctly across various dental specialties. By the end, you'll be able to interpret dental notes with confidence. Ready? Let's move on. Before we continue, think about this. Have you ever seen a claim denied because of incorrect terminology? Keep that example in mind as we go through the lesson. To understand anatomical terms, we always begin with the standard anatomical position. This position acts as a universal reference point for describing every direction in the body. In this posture, the person is standing upright, the face is looking forward, the arms are relaxed at the sides, the palms are turned forward, and the feet are set slightly apart. Every directional term you'll learn is based on this one orientation. Quick check. Why do you think it's so important for everyone to describe anatomy from the exact same reference position each time? Now let's look at some of the most common directional terms you'll see in dental documentation. When we say anterior, we're talking about the front of the body, like the front teeth or the nose. Posterior refers to the back, for example, the molars. Medial means moving toward the body's midline, like the space between the front teeth. And lateral means moving toward the sides, such as the right or left TMJ. Using these terms helps dentists describe exactly where a condition or symptom is happening. Quick thinking moment. If a provider writes, pain on the lateral side of the jaw, what area are they talking about? The left side or the right side? Great, now let's explore a few more directional terms you'll often come across in dental notes. When we use the word superior or cranial, we're referring to a position closer to the head. Inferior or caudal points toward the feet or the lower part of the body. Superficial or external means something is close to the surface, while deep or internal refers to a structure farther beneath the surface. These terms are especially helpful when describing impacted teeth, infections, fractures, and many clinical findings. Think it through. A dentist writes, deep infection near the lower molar. Which two directional ideas are being used there, and what do they tell you about the location? Next, let's look at how the body can be divided into sections, or planes. These terms are commonly used in imaging reports and surgical notes. The sagittal plane divides the body into right and left parts. The mid-sagittal plane divides it into equal right and left halves. The frontal plane separates the body into a front section and a back section, and the transverse plane divides the body into upper and lower parts. These planes help clinicians describe the exact angle or direction of a procedure or an imaging view. Quick reflection. If a CBCT scan reports a fracture in the frontal plane, what does that tell you about how the body is being divided in that image? Finally, let's look at two extremely important dental-specific terms you'll see in documentation and coding. When we say proximal, we're referring to a surface that's close to the point where two teeth touch. Distal means the surface that's farther away from that reference point, usually the backside of a tooth. These terms are essential when describing the exact surfaces involved in procedures like fillings, crowns, and other restorations. Quick check. If a dentist writes, distal decay on tooth number 14, which surface is being affected? The front surface or the back surface? Now that we understand the core anatomical terms, let's talk about why they matter so much for dental billers. First, they help you interpret clinical documentation accurately. When a provider writes something like distal caries on tooth number 2, you should instantly know what that means. They also support correct coding and billing. Even a small misunderstanding can lead to the wrong procedure code, and that often results in denied claims. Another reason these terms matter is that they help reduce errors. Many denials come from incomplete or unclear documentation. When you understand the anatomy, you become a much stronger and more confident reviewer. And finally, these terms improve communication with dental teams. Using the same language that dentists use makes everything smoother, fewer follow-ups, faster clarifications, and more accuracy overall. Pause and reflect. Think about a denial you've seen where the documentation wasn't clear. If the terminology had been precise, could that claim have been avoided? All right, let's test your knowledge. You've learned quite a bit so far, so let's see what you remember. This is just for practice. Here's your first question. Which direction describes movement toward the feet? Second question. Which anatomical plane divides the body into a front half and a back half? And third, what do we call the surface between two teeth? Take a moment to think through each one. Once you're ready, we'll go through the answers together. Let's start with the first question. Which direction describes movement toward the feet? The correct term is inferior, also called caudal. For example, when we say, the chin is inferior to the nose, we're simply saying the chin sits lower on the body. Now the second question. Which anatomical plane divides the body into a front half and a back half? That's the frontal plane, also known as the coronal plane. For instance, a CBCT scan taken in the frontal plane clearly separates the front structures, like the sinuses, from the back structures, such as the spine. And finally, the third question, what do we call the surface between two teeth? That surface is known as the proximal surface. For example, if decay is found between tooth 18 and tooth 19, the provider may chart it as caries on the proximal surface. Great job making it this far. Let's take a moment to recap what we've covered. First, understanding basic anatomy directly improves your billing accuracy. When you know exactly what the provider is describing, you can code confidently and correctly every single time. Second, directional terms and anatomical planes help you interpret documentation without confusion. They take the guesswork out of reading clinical notes. And third, having a clear grasp of these concepts reduces claim errors and helps prevent unnecessary denials. You're now equipped with foundational terminology that every dental biller should know. You might be wondering, with so many tasks in healthcare, billing, verification, and documentation, where should you get all these services in one place? Well, the answer is simple. You deserve a trusted partner who brings everything together under one streamlined solution, and that's where Kiben comes in. Kiben provides powerful EMR and telehealth tools that help clinics manage patient records and virtual appointments smoothly and efficiently. Medical billing and coding. We deliver accurate medical billing and coding to ensure you get timely, clean reimbursements without unnecessary claim denials. Insurance verification and pre-authorization. Our team performs quick and reliable insurance verification and pre-authorizations to minimize delays and guarantee approval before treatment. Reduce operational costs by up to 50%. With optimized workflows and expert support, Chiaben helps clinics reduce operational costs by up to 50%, saving your time, money, and valuable resources. Thank you so much for your attention throughout this lesson. You've taken an important step toward